Good morning, good afternoon, and good evening from wherever you are watching from. Um, it's a good day again. We are talking about erectile dysfunction in our last video, and we have to talk about what you do if you are diagnosed to have an erectile dysfunction, or if it is something that is disturbing you. Now, I will base it on three headings, major headings. One is lifestyle changes. Two, visit to your doctor, medical for every medication that will be given to you and medical treatment. Three is psychological upliftment or work on your psychology. Now, what are the things that you do to change your lifestyle? One of the things you do to change your lifestyle is, first of all, is to stop some habits. One of the habits you have that may cause erectile dysfunction is like taking substances like nicotine, also alcohol, and the other hard drugs. Those things can affect your erection, and you need to pull out from those ones or stop them or reduce the quantity that you take so that your erection can return. Somebody that is a chronic alcoholic cannot have good erection. Most times don't have good erections. Then those ones on drugs and those ones on nicotine, smoking and the rest of them, they normally have problem with their erection. So you need to work on those habits so that your erection can come back. Number two is that you have to change your diet. If your diet is composed of only carbohydrates and most things, food, you have to come down because it may lead you to obesity, and obesity is one of the causes of, or one of the leading causes of this erectile dysfunction. So you need to take more of fruits, more of vegetables. What are the fruits that are recommended? Some of the fruits that are recommended is like carrots, like this tiger nuts. Then you have cucumber. Then you have watermelon and garden egg, banana. Some of these fruits I named contain some substances that help erection. Another one that is important is that your diet, you have to know how to reduce on the diets that are adding enough fat or with plenty of fat to your waist. If you have plenty of fat on your waist, you have tendency of having this erectile dysfunction. So if you are somebody that have that kind of problem, you have to reduce the fat. Now, exercise is one of the things that you do to help yourself. If you are exercising or you have not been exercising, you have to change and start exercising today. There are some exercises that are called cardiovascular exercises, and these exercises help circulation, help your blood to circulate very well. Some of the exercises are like walking 30 minutes or more than in a day, cycling, running, jumping, swimming. Some of these exercises and more can help your circulation to be more, to be better. So in that case, the exercise helps to make your circulation good. Now, another important aspect is that you need to avoid some emotional things that may affect you. Some of the things are anger, extreme jealousy, extreme wicked, all those things that make your emotion to be controlling you. If you're under an emotional stress or psychologically you are depressed, it can affect your erection. So you need to come out of these things and have a good outlook to life so that you can have a free mind. Your system will work fine and the erection will be fine. But if you're under anger, under depression, under jealousy, unforgiveness, all those things that make you to be emotionally drained, those things will affect your erection. Then another issue that is very important is that you need to go to your doctor. Your doctor has a role to play in this matter. What is the role of your doctor? When you enter a hospital, tell your doctor what is your problem. The doctor will ask you some questions and you carry out some tests to get the root cause of your problem. And when you get to the root of cause of your problem, the solution is near. Now, some of the problems we may encounter medically may be this hormonal imbalance. Supposing your testosterone, that's the main hormone, is down. It is your doctor that will take responsibility for that. He knows how to bring down or how to increase the level of your testosterone, either by replacement therapy or he has other means of doing it. It's your doctor's decision, so give him that benefit. Then another issue that if you are on drugs, if you are taking tablets that are for medications that may affect your erection, carry all your medication, go to your doctor. The doctor knows the medication that is causing the problem. He removes them or he replaces them so that your erection can return. Then another issue is that some of the medications that are good to increase erection, the doctor has to take a decision. It's not you that will take a decision. Some of you go to the pharmacy, pick whatever will pick there, and start taking them without doctor's consultation. Now, some of these things can be detrimental to your health. You have heard of people dying on top of women just because of this problem. They buy drugs and they take it anyhow without doctor's prescription. Some of them can affect your heart, because what does it do? Most of those drugs, what they do is that they divert blood from your heart, from your system, down to your male organ, so that you have enough blood there to have a good erection. So those drugs, you have to take them under doctor's direction so that you don't cause yourself a harm because you want to satisfy somebody. You don't play with your life because you want to satisfy somebody. You have to be careful with your life. Life is more important than sexual satisfaction. So you have to be careful how you take those drugs. So it is your doctor's decision that will do that. Now, if you are somebody that is suffering from mental ill health or mental depression or all those things, consult your doctor, consult a psychologist so that he can bring you out of those conditions so that your erection can come. Then if you have chronic illnesses like diabetes, hypertension, and the rest of them, it is your doctor's duty to bring you out of those problems. Go to your doctor. Stop taking self-medication. Stop doing self-medication. Go to your doctor. Your doctor will know what to give you so that by the time you take care of all those chronic illnesses, you will come out of it and your erection will come back. So I think we have done a good job on this issue of erectile dysfunction, but we still talk more on it and subsequent videos. I still say what I say always. The more knowledge you have about your health, the healthier you live. I remain Dr. Solution. Thank you.